This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We've been talking a great deal about breast cancer this month, but October is also set aside to bring awareness to liver cancer. It's one of the deadliest cancers out there, and many times chemotherapy won't even make a difference. Studies show liver cancer is on the rise. The American Cancer Society reports this year nearly 31,000 people will be diagnosed with the disease. About 22,000 people will die. And more than 95% of people diagnosed with liver cancer are 45 years of age or older. And joining us today to tell us more are Dr. Halim Charbel, a gastroenterologist with Peninsula Regional Medical Center, and Jessica Brown of Hebron. Thank you guys for both being here. Jessica, we want to start with you. As I had just said, that many people who are diagnosed with liver cancer are over the age of 45. That wasn't the case with your husband. Tell us what happened.
He was 35 when he was diagnosed. We went in on Valentine's Day thinking he had a gallbladder issue to the hospital, and through a barrage of tests we found out that it was actually liver cancer, and he had a large tumor on his liver. And
you said he had been feeling pain in his side, discomfort.
Pain, yes.
And so basically he was diagnosed in March of 2012.
Yes.
He was given 2 years to live, and then when did he pass away?
January 5th of this past year, this year.
Wow. What was it like for you getting that diagnosis, especially at such a young age?
Well, up until his diagnosis, we were told that it was not cancer. He didn't follow any of the signs to have that type of cancer. None of the blood work, anything like that, said, no, you don't have it, it's just a lesion, we'll take care of it. And then we got the diagnosis. It was pretty hard hit, so we just started, doing everything that we possibly could to learn about it, learn what was going on, and through the test, understand
what exactly happened. Dr. Charbel, liver cancer is very aggressive and the odds of survival are slim. Why is that?
Unfortunately, liver cancer is a very aggressive, fast-growing tumor. We don't have good treatments for it, but most importantly, in most cases, is actually found pretty late. So when we find it, in many cases, we can't even resect it, or we have a patient who has already significant liver disease, cirrhosis of the liver, where the comorbidities are already severe that they cannot sustain the treatment.
And how would someone know that there's even a problem?
This is another major problem that contributes to the fact that the diagnosis is usually late. It doesn't have any specific symptoms. So obviously, if you're having pain, or if you develop jaundice, yellow discoloration of the skin, or if you already have cirrhosis of the liver and then suddenly something starts going badly without knowing what's the underlying cause, then we suspect it. But there is no one specific symptom that we look for and tells us that this is liver cancer.
There are several risk factors, and we're going to go over them. Tell us what they are.
So as you said, usually liver cancer occurs in older people. There are a few risk factors. Most importantly, hepatitis. So hepatitis B, around the world, there's a lot of hepatitis B, and that is a major risk factor for liver cancer. The other one that is more important than hepatitis B here in the US is hepatitis C, which causes chronic inflammation in the liver, and eventually with time it leads to cirrhosis of the liver and significantly increases the risk of liver cancer. And then cirrhosis of the liver from any cause, whether it's from hepatitis or whether from some genetic disorders of the liver or whether from non-alcoholic fatty liver disease, any kind of cirrhosis of the liver puts you at increased risk for developing liver cancer.
And obesity is also a risk factor as well.
Absolutely. Now we're dealing with a major problem with obesity here in the US, and we're seeing more and more people with cirrhosis because they develop what we call fatty liver, and that causes chronic inflammation, leads to cirrhosis of the liver, and as I said, anyone with cirrhosis has an increased risk of developing liver cancer. So this is definitely contributing to the fact that we're seeing higher numbers, as well as the fact that there was a major epidemic of hepatitis C in the US in the 60s and 70s, and now 30 and 40 years later, these patients are developing cirrhosis and liver cancer.
Something that people may find interesting is that the liver has the capability to rejuvenate itself. How does this help when it comes to liver cancer?
The liver is notorious for being able to regenerate, and that's why we are able to resect portions of the liver and sometimes large portions of the liver, and it will regenerate. So if we find a lesion that is small enough, and depending on the location, if it's only one lesion or a couple of lesions that we can resect, the surgeons can go in and cut these parts of the liver out, and the liver will survive. But again, that depends on the situation of the liver. In most cases, liver cancer develops in patients with cirrhosis, and in these patients, sometimes you cannot do a resection of the liver because they don't have enough liver function remaining, so these patients might end up requiring a liver transplant.
What are some preventative measures that we can take?
So the major preventative measures are: one, the vaccination for the hepatitis B, which we do now on a routine basis in the United States in children. Two, avoiding hepatitis C, which usually gets transmitted with sharing needle with any blood product. And three, avoiding excessive alcohol use, which may lead to alcoholic cirrhosis of the liver, and that also increases the risk of liver cancer. And definitely maintaining a healthy weight, so we avoid obesity, which eventually leads to fatty liver, cirrhosis, and liver cancer.
So obviously, if you feel something's not right, you should go to the doctor, and there are ways we can, take those preventative measures. And then finally, Jessica, you lost your husband at such a young age. If there's one message you can give out there to people, what would it be?
Just any little thing. Sometimes weight loss combined with fatigue, flu-like symptoms can, we brush it off, but these things add up and can lead to something serious like cancer somewhere in your body. So just be aware, and I think cancer takes the strongest of us because they don't complain.
Right. All right, so a lot of great information. Jessica, thank you so much. Dr. Chabel, a lot of good information. We greatly appreciate it. And if you'd like to read more about PRMC or to learn more about liver cancer, all you have to do is go to delmarvalife.com and click on the show tab. Well, still ahead on Delmarva Life, she was a local paramedic who had a passion for helping others, and her legacy lives on. We'll learn more about a 5K in honor of fallen paramedic Stephanie Calloway and how it's helping a cause close to her heart. And so many of us have kids in sports. The physical benefits are obvious, but they go way beyond a healthy body. Wait till you hear how much impact athletics can have in the classroom and social circles. And a little bit later, Freddie Long takes the Delmarva Life stage. Delmarva Life will be right back.
The cross it gave me hangs around my